Welcome to the fourth video of the Data to Impact series for the Twin Counties Partnership for Healthier Communities. My name is John Wallace, and I work with the North Carolina Institute for Public Health at the UNC Gillings School of Global Public Health. This session is one of 3 workgroup specific sessions where we highlight some key findings and priorities, and here we will discuss the findings relevant to the 3 C's workgroup. If you aren't already familiar with the partnership and the role of the workgroups, I encourage you to find out more on the partnership website, which is hosting these videos. The Twin Counties Partnership for Healthier Communities is a network of over 50 health and service organizations dedicated to supporting a culture of health and wellness in the Twin Counties. The partnership was formed in 2015 and has 3 work groups focusing on different health priorities. These work groups are physical and behavioral health, active living, and collaboration, communication, and community outreach. These work groups are responsible for carrying out the work of the partnership. In the spring of 2017, the North Carolina Institute for Public Health engaged these work groups to develop a community health survey with specific questions that address priorities and focus areas for each of the 3 work groups. The community health survey is described in detail in the first video of this series. Briefly, interviews were conducted with randomly selected households in neighborhoods throughout Nash and Edgecombe counties, and the results are representative of and generalizable to the residents of the Twin Counties. 2 types of data were used to inform community health efforts: primary and secondary data. Primary data is data that is directly collected by an agency or organizations, such as with the Community Health Survey. As detailed in the first video in this series, 324 interviews with randomly selected residents were collected for the Community Health Survey. This is our main source of primary data to inform the partnership. Secondary data is data that is collected by another agency or organization. Some of the secondary data sources used to inform the partnership are the County Health Rankings and the Healthy North Carolina 2020 Objectives. Each spring, the County Health Rankings are released for counties across the country, assessing health outcomes and health factors from a variety of data sources. Each county is ranked statewide, and in 2018, both Nash and Edgecombe were in the lower half of the rankings for both health outcomes and health factors. The health rankings certainly justify the need for continued work towards health improvement in both counties. In addition to the county health rankings, the North Carolina Institute of Medicine has outlined focus areas, objectives, and intervention strategies as part of the Healthy North Carolina 2020 report. Progress towards those targets is released for the state each year, and counties can be compared against the objectives to determine what progress is being made towards attaining the goals. As we'll see on the next slide, there's still progress to be made towards meeting the Healthy North Carolina 2020 targets. In this session, we'll first take a look at the secondary data that relates to the 3 C's work group and reference them against some of the health data collected in the Community Health Survey. Then we'll go through the key findings as identified by the 3 C's work group. First, we'll look at some of the Healthy North Carolina 2020 objectives as they relate to the 3 C's work group. This table outlines selected quality of life issues that were identified in the Community Health Survey, as they align with the Healthy North Carolina 2020 objectives in the middle of the table. By comparing what community members felt was important with targets set by the statewide health improvement plan, we can start to identify which gaps we might need to focus on. Here we have highlighted those that are most relevant to the 3 C's work group. I want to call your attention to this green column, which represents the percent of Twin Counties residents who indicated that this was a quality of life issue. Now going across the yellow highlighted row, we see that 16% of the Twin Counties residents felt that nutrition and access to healthy food was an important quality of life issue in the community. The most similar Healthy North Carolina 2020 objective is increase the percentage of adults who consume 5 or more fruits and vegetables per day. The target to be obtained by 2020 is 29%. You can see that Nash County is below this target at 16%, and Edgecombe is also below the target at 10%. You might also notice that not all the Healthy North Carolina 2020 objectives are a one-to-one match to the quality of life issue, but these are the Healthy North Carolina 2020 objectives that most closely aligned to the quality of life issue listed. Also note that much of the data are from various secondary sources, but a few are from the Community Health Survey data. So this table is just one way that we can use our community survey findings and supplement them with additional secondary data. Now we will move on to some of the key findings from the community survey. As we mentioned earlier, the work groups provided feedback and specific questions relevant to their priorities and focus areas in the development of the community health survey. For the 3 C's work group, we asked a series of readiness questions about interest in a website or app sharing community health events and services, and access to worksite wellness programs. Additional questions were asked related to the health status and behaviors of residents, including quality of life issues, some of which we saw on the previous page, self-reported health issues, sources of news about community health events, internet access and use, and awareness and use of United Way's 211 hotline. Now let's look at some of the results. When asked about interest in worksite wellness programs for employees, the vast majority felt that access was moderately or very important, but many were not aware of existing worksite wellness programs. This became a theme for many of our readiness questions, where many community services were viewed as important and people would be likely to use them, but most were unaware such services existed. When the 3 C's work group were presented with the results from the community health survey, they identified the following key findings. Residents thought worksite wellness was important and they would likely use those programs, but awareness of those programs is low. Another notable finding was that the top 3 communication methods where people would get information about community health events is from friends and family, social media, and newspapers. The survey also found that roughly 30% of the Twin Counties residents have not used the internet in the last 30 days, and overall, the vast majority weren't aware of United Way's 211 services, and very few residents have used it. This concludes the 3 C's workgroup video. The final video of the Data to Impact series will introduce you to the Community Health Survey Data Workbook, which contains data and figures for all of the data collected from the Community Health Survey. This workbook and additional background on the functions and roles of the Twin Counties Partnership for Healthier Communities and the work groups can be found on the partnership website. We hope you find these videos helpful and thank you for viewing.